Nursing diagnosis 5 marks. Introduction. Diagnosis is the second phase of nursing process. It is referred to as analysis as well as problem identification for nursing diagnosis. It provides the basis for the selection of nursing intervention to achieve the outcome for which the nurse is accountable. Professional nurses are responsible for making nursing diagnosis. Evolution of nursing diagnosis. The term diagnosis was first introduced in the lesson literature in 1950. Definition. Diagnosis refers to the reasoning process. Diagnosis is a statement or conclusion regarding the nature of phenomena or a critical judgment about individual, family, or community response to actual or potential health problems or life process. Nursing diagnosis provides the basis for selection of nursing interventions to achieve outcome for which the nurse is accountable. According to Nanda, 1990, nursing diagnosis of clinical judgment about individual, family or community response to actual and potential health problems for life process. Nursing diagnosis provides the basis for selection of nursing intervention to achieve the outcome for which the nurse is accountable. Nursing diagnosis is a statement that describes a clinical judgment about the patient's response to actual and potential health problems that the nurse is licensed and competent to treat. Uniqueness of nursing diagnosis. Nursing diagnosis is a statement of a patient problem, not a medical diagnosis. It can be actual risk for wellness, not a nursing action. It is within the scope of nursing practice, not a physician order. It is a directive of nursing intervention, not therapeutic treatment. 13 domains of nursing diagnosis. Section Health Promotion, Section Nutrition, Section Elimination Exchange, Section Activity, Rest, Section Perception or Cognition, Section Self-Perception, Section Role Relationships, Section Sexuality, Section Coping or Stress Tolerance, Section Life Principles, Section Safety, Protection, Section Comfort, Section Growth and Development. Purpose, Section to identify how an individual, group or community responds to actual and potential health and life processes. Section Identify the factors that contribute to or cause health problems, etiologies. Section Identify the resources or strengths the individual, group or community can draw on to prevent or solve problems. Section to draw conclusions regarding a patient's specific problems or needs in order to plan and deliver effective care. Section identifies areas that nurses can resolve or enhance. Section demonstrates professional judgment. Section organizes decision-making as a part of the nursing process. Section promotes accountability. Section provides communication among nurses and other healthcare professionals. Section promotes use of standardized language and process. Section a means of individualized care. Section provides a mechanism for conducting nursing research. Characteristics of nursing diagnosis. It states clear and concise health problem. It is derived from existing evidences about the client. It is potentially commendable to nursing therapy. It is the basis for planning and caring of nursing care. Development of nursing diagnosis. In 1982 the conference group accepted the name North American Nursing Diagnosis Association. Nanda, Nurses in Canada and U.S. Purpose of Nanda to define, refine and promote a taxonomy of nursing diagnostic terminology of general use to professional nurses. Taxonomy is a classification system or set of categories arranged on the basis of single principle or set of principles, prioritizing nursing diagnosis. Section Airway, Section Breathing, Section Circulation. Members of Nanda. Staff nurses. Clinicals. Faculty. Directors of nursing. Deans. Theorist and researchers. Types of nursing diagnosis. Actual nursing diagnosis. Possible nursing diagnosis. Wellness nursing diagnosis. Syndrome nursing diagnosis. Risk nursing diagnosis. Health promotion nursing diagnosis. Actual nursing diagnosis. It is judgment about the client response to health problem that is present at the time of nursing assessment. It is based on presence of signs and symptoms. Example, ineffective breathing pattern and anxiety, Disturbed sleep pattern risk nursing diagnosis. It is a clinical judgment that a client is more vulnerable to develop the problem than others in the same or similar situation. It is a clinical judgment that a problem doesn't exist because but the presence of risk factor indicates that a problem is likely to develop. Nurses intervene. It doesn't have any subjective or objective cues. Example: a client with diabetes mellitus or compromised immune system is at higher risk than others. Risk for infection. Risk for injury. Risk of impaired skin integrity related to surgery. Health promotion. Nursing diagnosis. Describe human responses to level of wellness in an individual, family or community that have a readiness for enhancement. Clinical judgment about the person's, family's or community's motivation and desire to increase well-being. Example: readiness for enhanced family coping. Readiness for enhanced self-esteem. Possible nursing diagnosis. It describe a suspected problem for which current and available data are insufficient to validate the problem. A possible nursing diagnosis is one in which evidence about health problem is incomplete or unclear. A possible diagnosis requires more data either to support or to refuse it. Example: possible social isolation related to unknown etiology. Possible social isolation related to unknown etiology. Potential risk of constipation as a result of enforced forced bed rest syndrome. Nursing diagnosis. It is a cluster of nursing diagnoses that frequently go together and present of clinical picture. A clinical judgment describing a specific cluster of nursing diagnoses that occurs together and are best addressed together and through similar interventions. Example: rape trauma syndrome. Wellness nursing diagnosis. It is clinical judgment about an individual, group or community in from a specific level to wellness to a higher level of wellness. Example: family coping. Potential for growth related to unexpected birth of twins. Components of nursing diagnosis. 1. Problem statement, problem and its 2. Definition. 3. Etiology. Defining characteristics. Problem statement. It describe the client health problem or response for which nursing therapy is given clearly and concisely in a few words. Example: knowledge deficit medications. Qualifiers are words that have been added to some NANDA labels to give additional meaning to the diagnostic statement. Some qualifier is also added to give additional meaning to the statement. Suggest impaired, decreased, ineffective, acute, chronic, deficient, interrupted, imbalanced, compromise. Etiology, related factors and risk factors. This component identifies one or more probable causes of health problem. It helps the nurse to give individualized patient care. Identify one or more probable causes of the health problem, give directions to the required nursing therapy. Example: anxiety, problem related to hospitalization, treat to physiologic integrity. Possible cancer diagnosis. Problem: constipation, etiology: long-term laxative use, inactivity and insufficient fluid intake. Defining characteristics. These are the clusters of sign and symptoms that indicate the presence of a particular diagnostic label / cluster of signs and symptoms that indicate the presence of a particular diagnostic label. Actual diagnosis. Client sign and symptoms. Risk diagnosis. No subjective signs are present. Example: fluid volume deficit related to decreased oral intake manifested by dry skin and mucous membranes. Nursing diagnosis process. Assess the client health status. Validate data with other resources. Is additional data needed? Yes/no. Interpret and analysis of data plus if yes again. The first step: assess the client health status. Data clustering, group sign and symptoms, classify and organize. Look for defining characteristics. Identify client needs. Formulate nursing diagnosis and collaborative problems or synthesis analysis. Critical thinking. Formulation of nursing diagnostic statement. The basic format for a diagnostic statement is problem related to etiology. However, nurses must be able to write 1, 2, 3 or 4-part diagnostic statement, as well as some variation of each. Basic 2-part statement. It is used for actual, highest and possible nursing diagnosis. It includes the following: 1. Problem, P. Statement of client response. 2. Etiology, E. Factors contributing to or problem causes of response. Is the 2-part joined by the words related to, or associated with rather than due to, example non-compliance, diabetic diet, related to denial of having disease, pain related to surgery. Basic three-part statement. The basic three-part statement is called the PS1. Problem, P, statement of client response to. Etiology, E, factors contributing to or probable cause of response. 3. Sign and symptoms, S, defining characteristics manifested by the client. 4. Using secondary to divided the etiology into two parts, thereby making the statement more descriptive and useful. Example: high risk for impaired skin integrity related to decreased peripheral circulation secondary to diabetes. 5. Adding a second part to the general response or NANDA label to make it more precise. Example: problem, impaired physical mobility, plus descriptor, inability to work related to etiology, knee joint stiffness and pain secondary to muscle atrophy. 4-part statement. These statements are a combination of basic statement and variation. 4 and 5 discuss about example 1. High risk for impaired skin integrity. 2. Pressure sore related to. 3. Immobility. 4. Secondary to presence of traction and casts. Common errors in writing the diagnostic statement using the medical diagnosis example section: self-care deficit related to stroke. Correct self-care deficit related to neuromuscular impairment relating the problem with an unchangeable situation example section: risk for injury related to blindness. Correct risk for injury related to unfamiliarity with the surroundings section: post-operative lung condition related to bed rest. Correct ineffective airway clearance related to general weakness and immobility section: catheterization related to urinary retention. Correct urinary retention related to perineal swelling section: constipation related to nutritional intake. Correct constipation related to inadequate dietary bulk and fluid intake. Avoiding errors in developing a nursing diagnosis section: accurate and complete collection of data section: use of an organizational framework for clustering data cues section: thorough analysis and validation of data section: correct writing of the nursing diagnosis advantages. Communication. Quality improvement. Charting limitations. Limited to nursing professional. Imprecise language. Limit nursing practice. Lack of consensus among nurses regarding the NANDA approved nursing diagnosis list. Nurses are overworked and have less time with clients. Care is still organized around the medical diagnosis. Nurses are afraid they may be ridiculed for using nursing diagnosis. Nursing diagnosis list does not always fit the client's situation. Nurses may be unable or unwilling to use nursing diagnosis because of incomplete knowledge. If a nursing diagnosis is inappropriate and as a result the intervention are inappropriate or lacking, the nurse is liable for these errors in judgment. Overcoming barriers to nursing diagnosis section: familiarity of nursing diagnosis language empowers the nurse to communicate more effectively section: healthcare agency administrators and medical staff need to be more supportive of the use of nursing diagnosis section: enhanced communication between clinical nurses and leaders will increase the development of nursing diagnosis section: most nursing education programs offer standardized content related to nursing diagnosis section: experienced nurses need opportunities to review nursing diagnosis section: every attempt should be made to describe phenomena that does not fit into existing nursing diagnosis language section: the nurse may be on the threshold of documenting a new nursing diagnosis.